you don't have the pain and you're like, oh, I feel better, I'm going to stop taking it. No, you're just going to make the bacteria resistant to the current antibiotic. And then when it comes back, it's going to come back stronger and more aggressive. So definitely finish taking the whole course of antibiotic that has been prescribed to you. Hi, everybody. My name is Anastasia and welcome to my channel. If you've been here before, thank you so much for coming back. And if you're new, come on in, make yourself at home. Here we talk about everything. Today, I want to talk about a very common, sometimes preventable, and definitely treatable infection that people get. Is very common, but some people are ashamed and shy to talk about it, and they sit and suffer in silence when there's really no need to. There are treatment plans available. I am talking about UTIs, urinary tract infection. So UTI is an infection of the urinary tract, which involves the kidney, the bladder, the urethras, and the ureters. And unfortunately, UTIs are more common in females than it is in males, just based on the female anatomy. So the female urinary tract is actually shorter than the males. So it's easier for bacteria to kind of make their way up into the bladder, causing an infection. And then another thing also is that because of the female anatomy, it kind of sits in between the vaginal canal and the anal canal. So it's just easier for the bacteria to hop in from one hole to the other. They're all just in the same general vicinity. So they're all in the same place. Now, some signs and symptoms of UTI to watch out for. Urinary frequency and urgency. So if you go to the bathroom, you urinate, you come out, and a few minutes later, you feel the need to go again, like it's urgent, you've been holding it, but you haven't been holding it because you just went to the bathroom. You have pain. Sometimes it can be cramps in your lower abdomen. Definitely a sign of UTI. If you have a foul, smelly urine, definitely a sign of UTI. If your urine is cloudy, a sign of UTI. If you have blood in your urine, definitely seek medical help. There's no need to sit and wait around. There are ways to make you feel better. Another sign and symptoms of UTI, and if you have these, then it means the infection has made its way all the way to the kidneys, causing the symptoms. If you have fever and chills are a late sign of UTIs. Now, what causes UTI? There are several things that causes UTI, such as poor hygiene, especially in females. And when I say poor hygiene, I don't mean you're not taking care of yourself. You could be taking care of yourself, but you're just doing it the wrong way. One way is when you go to the bathroom and you're wiping yourself. Make sure you're wiping from the front to the back. Like I said, everything is all in the same area, and the front is considered cleaner than the back. So if you're wiping from the back to the front, you're bringing all those bacteria from the backside to the front, and you just put yourself at a higher risk for getting an infection. Another thing that females do is using like feminine products that are scented with sprays and all those things. They irritate the urinary tract, making it higher probability of an infection. If you're dehydrated, you're definitely also putting yourself at a higher risk of UTIs. If you are diabetic, unfortunately, diabetes suppresses the immune system, making you more susceptible for infection. The urine is sometimes sweeter with diabetic patients. And another thing for females is birth control. There are some birth control pills that put you at a higher risk of UTIs, like the diaphragm. So if you're using the diaphragm as a birth control pills right now and you keep getting UTIs, this is definitely a conversation to have with your OB to see if maybe you can switch to a different form of birth control. Now, once you have any of these symptoms, you have to go and get medical help. You can either go to your OBGYN or you can go to your primary. Any one of these two providers are more than likely to help treat a UTI infection. And there's one definitive way of knowing which bacteria is causing your UTI, because there are many different bacteria that causes UTI. So the same medication that we're going to give for bacteria A might not work for bacteria B or bacteria C. So we do a test called urinalysis to figure out exactly what bacteria is causing your specific UTI or my specific UTI, and then you get antibiotics to treat that specific bacteria. Now, when it comes to antibiotics, this is what I would say. I know my people. We take the medication. After day 2, we feel better and we stop taking it. You cannot do that with antibiotics. You have to take the whole dose. So if your prescription is for 14 days or 7 days, you have to make sure you take all of it. You cannot just take it for the first 2 days. You feel better. Your urine is not cloudy anymore. You don't have any fevers. Your urine doesn't smell. You don't have the pain. And you're like, oh, I feel better. I'm going to stop taking it. No, you're just going to make the bacteria resistant to the current antibiotic. And then when it comes back, it's going to come back stronger and more aggressive. So definitely finish taking the whole course of antibiotic that has been prescribed to you. Another thing is cranberry. A lot of people talk about cranberry and UTIs. It's not a cure. Cranberry can be a preventative measure. And it's not the cranberry juice with the sugar. If you're drinking cranberry juice, definitely drink the pure cranberry juice, the bitter kind, the pure ones, not the made from concentrate with tons and tons of sugar. Because if you're drinking those, you're causing more harm to yourself than good, because it's just sugar that you're drinking and you're not doing yourself any favors. All right, guys. Thank you so much for watching. If you have any questions, please put it down in the comments. I love when I read comments about, things that I have said that people are taking something from. It makes me so happy because then I feel like I'm doing something good and I see a point for this channel. So please put it down in the comment if you have any questions or concerns. Please share, thumbs up this video, and I'll talk to you soon. Bye.